With Health Cabinet Secretary Duale, who has confirmed that Kenya is in talks with the United States government on collaboration of preparedness and response mechanisms for the Ebola virus disease. This comes hours after reports emerged of plans by the Trump administration to set up a quarantine and treatment facility in Kenya for U.S. citizens. On Wednesday, Kemri announced boosting the current infrastructure on tracing and testing for the Ebola virus, with neighboring Uganda announcing the temporary closure of its border with the DRC in order to tame the spread of the deadly virus. Let's begin our broadcast with our very own Laura Tieno.
As fears gripped the globe over the spread of the Ebola virus disease, Health CS Duale has confirmed that Kenya is in talks with the United States government. The notice came hours after reports indicated that the United States government was to set up a treatment facility on Kenyan soil for the quarantine and treatment of U.S. citizens suspected to have had contracted the virus. In a statement, Duale said the talks were on collaboration on strengthening preparedness and response for the Ebola virus disease and other emerging threats. The statement, which neither confirmed or denied the setting up of such a facility, said any international health cooperation will be guided with the Kenyan law and the government will prioritize protection of Kenyan citizens, including frontline health workers.
Anybody we feel who has been to that region in the last 1 month, we are tracing them and making sure that we protect our country. This particular virus, Ebola virus, this strain, doesn't have a vaccine. So we have to be very, very careful.
Duale said, and I quote, Kenya's role in regional and global health security has been built over many.
The number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States. And so the State Department and other agencies represented here, the Centers for Disease Control, HHS, others are working very, very hard to contain this crisis to the countries where it's currently located, particularly the Democratic Republic of the Congo. And so we've surged assistance to make sure that is being contained there. And obviously, multiple agencies involved here are also very involved in tracking people, just to make sure that nobody comes into this country that has Ebola and creates a problem for us. And we feel like we've got good efforts in place to do that, and Americans should feel assured that the President and his administration is doing everything we can to protect them on that front.
26th of May 2026, 10 hours ago, New York Times. Habari zinasema nini? Ebola outbreak. Trump administration to send Americans exposed to Ebola disease to Kenya for the state-of-the-art facility treatment. Very nice. Very nice. It has already been confirmed that Kenyan health system is better than America by 1,000 miles. You know, Kenya has a better, response to tackling and, containing Ebola outbreak than United States of America. And, it's so good of us. It's so good of us, that Americans who are affected, wameambukizwa na hii ugonjwa, that, it is better to treat them in Kenya, than in America. Very nice. And why do we have to worry, Kenyans? I mean, SHA is working. SHA is a world-class program. The richest man in Kenya, Duale, told us, so we should believe him. And why should we worry if you are a follower of Prophet Owuor, aka watu wa kufagia barabara na maji pale Nakuru, who has proven scientifically that he can heal all manner of diseases in this country? Dear two-term people, don't worry about this. This disease will only be infected to one-term people. This Ebola outbreak, Kenya has a good containment facility that this disease is not going to spread to other parts of the country. Kenyans, tusikwe na worry. I mean, our government is really working to deliver on this. And we shall blame on Uhuru Kenyatta if it's going to fail. Uhuru Kenyatta is there. He is the one whom we are going to blame if Kikuyus or, Kenyans will protest. We will say Uhuru Kenyatta is inciting the Kikuyus to only protest against this Ebola issue in Kenya. It's not the Kenyans doing so. So we are safe. I'm telling you, Kenyans, mutalipa. There are many ways to pay back. Sharp boys, muliambiwa hapo, unajua utachukua deni, hakuna interest. There are many ways you will pay back. Mutalipa na mdomo, mutalipa na sehemu za huko nyuma. God forbid this Ebola, oh my goodness guys, will not be something that is going to be bad to our country. You've seen what it does to people in Congo. You've seen what it does to people in Liberia and Sierra Leone. But meanwhile, mwende tu kusema tu vidole viwili, two term. These are some of the foreign policy issues that we always warn you about. And it was possible because some months ago, Kenya signed a health data transfer and access deal with the United States of America. All your data, health data, can be accessed by Marco Rubio and other American officials, courtesy of Uhuru Muigai Kenyatta, the current president of the Republic of Kenya, not William Samoei Ruto. Very nice. Tumakinike sana wa Kenya. Masalama.
Now, ladies and gentlemen, about 2 days ago, something very unusual was revealed to the people of the Republic of Kenya. That the Ministry of Health in the Republic of Kenya was in negotiation with the United States government for the purpose of cutting a deal so that infected people or infected US citizens with Ebola virus while abroad will be brought to Kenya for treatment in a new setup facility. Ladies and gentlemen, I want you to sit down and actually think about it. Here, America is not going to allow American citizens who have been outside the country and have been exposed to Ebola virus to be taken into America so that they can be treated in their land. And so out of all the countries in the world that the American government would have set up a facility where they will treat their citizens affected by Ebola while abroad, they saw Kenya is the best place that they can crack a deal with so that they can be dumping their citizens affected by Ebola virus in Kenya for the purpose of treatment. I want you to sit down. No, don't argue. I want you to sit down and think. Currently, the outbreak of Ebola virus is one for the book. It has reached a point where the world is even at a threat of going into another crisis where transport might even be put on lockdown so that Ebola virus can be contained. But now, America says their goal is to ensure that no Ebola virus case enters in the United States. But to ensure that does not happen, because they have citizens that are working outside America, and in one way or the other, they might have been exposed to Ebola virus. They now are negotiating with the Kenyan government to come and dump their citizens in Kenya so that they can be treated in Kenya. And I dare tell you, Ebola virus is a virus that is transmitted through the air. It is a virus that is so dangerous. I mean, it is similar to COVID-19, only that COVID-19 had a longer lifespan for anybody affected by it. And the containment for COVID-19 was to be carried out swiftly. I mean, even if you had been affected, it wouldn't be easy to affect other people. But for Ebola, once those people are brought into the country, that means every specimen of Ebola virus from different parts of the world through American citizens, they will be brought in Kenya through a backdoor deal that is being negotiated between Kenya and the United States so that they can be treated in the Republic of Kenya. Yet we know currently Kenya has been able to contain itself from the Ebola virus. Yet it is opening doors for affected citizens of the United States to be brought back, to not go into US but to be brought in Kenya for treatment, which means that we are being tested as the guinea pigs of Ebola virus. Ebola virus, even though they are saying that they have opened up facilities for treatment, I tell you, it will be uncontained because different variants of Ebola viruses that will be carried by different people that will be brought into the country through this deal cracked between Kenya and the United States now will be in the country. Once those variants come into the Republic of Kenya, they will be so dangerous to the people of this republic. And we sit down and ask ourselves, I mean, is there in any way that this government cares about its people? Listen, those that are being brought, not Kenyan citizens abroad affected by Ebola virus. These are American citizens affected by Ebola virus. But because America wants to keep itself free from Ebola virus, they will be dumping their affected citizens in Kenya. Now, the shocking betrayal Ruto has mortgaged Kenyans' health to Donald Trump and agreed to host the US Ebola casualties. This is absolute madness. British-backed war, criminal and mass murder, William Ruto, has gone completely wrong. I mean, in an act of unbelievable treachery, he has mortgaged the health and lives of every Kenyan to the United States President Donald Trump, against all logic, common sense, and constitutional order. I mean, this illegal move has turned Kenya into a dumping ground for American Ebola casualties. How dare Ruto do this? This is exactly what happens when you elect somebody who is who is self-centered to the point that he does not think that this Ebola virus could in one way or the other get to him. He knows how broken our systems are. He knows the the Ministry of Health is rotten with corruption. He knows we are dangerously ill-equipped to handle even a minor outbreak, let alone a deadly Ebola pandemic. Yet because he has been bribed with money going straight into his personal pockets, he thinks he can trample the Constitution and sign away our lives like cheap cargo. This is not leadership. I mean, this is criminal negligence of the highest order. This is a death sentence disguised as a deal. It is high time that the people of this republic wakes up. And President Donald Trump, as of Wednesday evening, spoke, revealing that for them, they are trying in every way possible to ensure no Ebola virus case enters the United States. And to do that, they have set up a dumping site for Ebola virus cases in Kenya. And I have told you, I want you to sit down and think about that. Think about it for a minute. You who is saying that William Ruto even needs a two-term, will you even be able to reach that time for election to vote him in if currently we are being auctioned? I mean, our health system is one that even in minor cases of cholera and malaria, it cannot be able to contain itself. They have been unable to contain cases of malaria and cholera and typhoid. But they are accepting cases of Ebola into the country because of a deal that has been cracked between William Ruto and President Donald Trump. Now I want you to listen to this very carefully. US citizens infected with Ebola to be quarantined in Kenya in the US-Kenya deal. US plans to quarantine Americans exposed to or infected with Ebola on Kenyan soil. Facility intended to handle patients from the DRC and Uganda Ebola outbreak, 906 suspected cases, 105 confirmed, 10 deaths. US CDC staff already received deployment notices to Kenya. LCS Duale issued a 2-page statement acknowledging ongoing discussions. No clarity on who approved the deal, on what legal basis, or what diplomatic framework applies here. Ebola facility pending Kenyan government approval as of Tuesday, suggesting it wasn't yet finalized. But you know what? They have already signed over your lives. I want to read an article that has been published by the Standard newspaper, meant for the Thursday, which says, guinea pigs, Ebola unit uproar. And the first, on the front page it reads, fear, anger, and shock greeted the news that the US plans to send Ebola-exposed Americans to a quarantine and treatment facility on Kenyan soil in what seems like a government's willingness to turn the country into an offshore Ebola quarantine station. The controversial plan has ignited public outrage, with medics warning that the country risks importing one of the world's deadliest viruses into a fragile health system already struggling with basic care. While the government insists the arrangement is lawful and necessary for global health security, it is a dangerous geopolitical experiment turning Kenyans into guinea pigs for the United States. Ruto turned Kenya into Trump's Ebola, has turned Kenya into Trump's Ebola dumping ground. Americans infected with one of the world's deadliest viruses, unwelcome at home, are being shipped to Nairobi. No parliamentary approval, no public consent, no accountability. Kenyans are literally the guinea pigs here. Mtazamaji, this virus has killed a lot of people in the world. Currently, it came back. This time, the new strained Ebola virus is so dangerous that even medical practitioners all over the world have not determined what medicine they can use to treat it yet. But kwa sababu wa Amerika hawataki the Ebola virus to get into their land, they are sending their own American citizens to Kenya who have been infected while abroad. According to a report issued by the AP report this evening, May 27th, it says President Donald Trump's administration is planning to send Americans who are exposed to Ebola while abroad to a new facility in Kenya instead of flying them to the United States, an administration official said on Wednesday. The quarantine and treatment center being set up by the Department of Defense, State and Healthy and Human Services will be designed for Ebola patients who need to get out of the Democratic Republic of Congo and receive care quickly, said the official, who insisted on anonymity to share the Republican administration's plans. The person said the plan would help patients avoid an hours-long medical evacuation to the US. It was unclear where in Kenya the new facility will be built or whether the Kenyan government has signed off the plan. The official who revealed the story said the facility will be able to care for the full spectrum of Ebola, a rare but severe disease that is often fatal in people. But the official said people may be transported elsewhere for more advanced care as appropriate. Kenya's health minister, Duale, confirmed officials were talking with the US about preparedness and response mechanisms for Ebola, but didn't address whether the country would establish a treatment facility for Americans. Any arrangements regarding international health cooperation will be guided by Kenya's national laws, public health regulations, biosafety and biosecurity standards, and the government's responsibility to safeguard the health and welfare of Kenyans, Duale said in a statement. For decades, medical experts have suggested moving patients suffering from Ebola and similar illnesses as little as possible in case their condition worsens. The Public Health College Dean at the University of Nebraska Medical Center, Dr. Ali Khan, said. Now, these people, they are killing. They are kidding us. During a massive Ebola outbreak in West Africa in 2014 and 2015, more than a half dozen infected Americans were brought back to the United States. That experience prompted the establishment of a US network of quarantine and isolation facilities across the country. But during that early outbreak, Trump, then a businessman and reality TV star, repeatedly criticized then President Barack Obama, a Democrat, for bringing infected Americans home for care. I mean, he said that Americans should be treated elsewhere who are affected and not in America's soil, which means he said that Americans who had been infected were being taken into the country, and that would risk the whole of America being infected by Ebola. But now, kwa sababu US feels that they are special in a way and that their people shouldn't be exposed to Ebola virus, now they want to dump their infected citizens in the Republic of Kenya. Tazamaji, nataka ukae chini ileo ujiulize, is this a government that even cares about its own people? I mean, even as a president or a cabinet secretary, do you think that you are immune to these Ebola cases? Here is where we say we pray to God to intervene. Because in such circumstances, I mean, what else can we do? These people are proved beyond reasonable doubt they will violate the law in every instance for the sake of enriching themselves. And that is why they are doing this with the United States. Not for the purpose of bilateral relationship with the United States. It's for the purpose of pocketing millions so that they can bring Ebola into Kenya. Tazamaji, ningetaka kuyasikia maoni yako. Leave a comment on the comment section. See you in our next video. This is the Kenyan Daily Report. Subscribe.
A very critical emergency. It's happening in DRC Congo and Uganda. Over 200 people have so far lost their lives in DRC. As a government, as a ministry, we have put all measures in place along our borders. We have put scanners. At the airport, we are doing a very serious screening of all passengers entering our country, and more so those who have either coming from Uganda or were on transit through Kinshasa. So everybody will go under serious screening and verification. We are also putting up holding and areas within the border in the event that we get a case. So the country is fully prepared for this Ebola. But I want to ask the citizens that they have a duty to protect themselves. Make sure that if there's any of your relative who feels sick and he had recently been to Uganda or DRC, please go to the nearest medical facility so that our medical and healthcare workers can check. Thirdly, and we're saying we're doing a lot of traceability. Anybody we feel who has been to that region in the last 1 month, we are tracing them and making sure that we protect our country. This particular virus, Ebola virus, this strain doesn't have a vaccine. So we have to be very careful. So, but I want to assure the citizens that all our health systems are in top gear. Our laboratories, 3 of them are ready and working 24/7 to make sure they test for any specimen. We also have 1 mobile laboratory at the border between Uganda and Kenya, border between South Sudan and Kenya. All our ports of entry are